161. The nurse should include the wound care nurse in the care plan for a patient with a stage 4 pressure ulcer. True or false? Answer: true. Rationale: wound care nurses provide specialized expertise for complex wounds, ensuring comprehensive care per the Joint Commission standards. 162. A nurse can administer a medication without checking the patient's wristband. True or false? Answer: false. Rationale: checking the wristband ensures correct patient identification, preventing medication errors per the Joint Commission's two-identifier rule. 163. The nurse should report a patient's change in condition to the physician immediately. True or false? Answer: true. Rationale: immediate reporting of condition changes ensures timely intervention, promoting patient safety per ANA standards. 164. A UAP can assist with performing a non-invasive blood pressure measurement. True or false? Answer: true. Rationale: non-invasive blood pressure measurement is within the UAP scope if trained, with the nurse interpreting results per NCLEX-PN delegation guidelines. 165. The nurse should prioritize a patient with a new seizure over a patient with a scheduled diagnostic test. True or false? Answer: true. Rationale: a new seizure is a medical emergency requiring immediate intervention over routine tests per ANA prioritization principles. 166. A nurse can delegate the administration of an 4-push medication to an LPN. True or false? Answer: false. Rationale: 4-push medication administration requires advanced training and is typically within the RN scope, not the LPN's, per NCLEX-PN scope of practice guidelines. 167. The nurse should ensure a patient's discharge instructions include medication reconciliation. True or false? Answer: true. Rationale: medication reconciliation in discharge instructions prevents errors and promotes safety per the Joint Commission standards. 168. A UAP can perform a patient's initial respiratory assessment. True or false? Answer: false. Rationale: initial respiratory assessments require clinical judgment and are within the RN scope, not the UAP's, per NCLEX-PN scope of practice guidelines. 169. The nurse should report a patient's near-miss incident to the risk management team. True or false? Answer: true. Rationale: reporting near-miss incidents supports quality improvement and prevents future errors per the Joint Commission safety protocols. 170. A nurse can ignore a patient's request for a translator. True or false? Answer: false. Rationale: providing a translator respects patient rights and ensures comprehension per ANA cultural competence standards. 171. The nurse should include the dietitian in the care plan for a patient with diabetes. True or false? Answer: true. Rationale: dietitians provide expertise in dietary management, ensuring comprehensive care for diabetic patients per the Joint Commission standards. 172. A nurse can administer a medication without a physician's order in a non-emergency situation. True or false? Answer: false. Rationale: medications require a physician's order in non-emergencies to ensure safety and compliance per ANA's standards of practice. 173. The nurse should ensure a patient's bed alarm is activated for those with impaired mobility. True or false? Answer: true. Rationale: activating bed alarms for mobility-impaired patients prevents falls, promoting safety per the Joint Commission standards. 174. A UAP can assist with performing a sterile tracheostomy suctioning. True or false? Answer: false. Rationale: sterile tracheostomy suctioning requires sterile technique and is outside the UAP scope, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 175. The nurse should prioritize a patient with a heart rate of 140 beats/min over a patient with a scheduled medication. True or false? Answer: true. Rationale: a heart rate of 140 beats/min indicates tachycardia, requiring immediate assessment over routine medication per ANA prioritization principles. 176. A nurse can delegate the administration of a topical medication to a UAP. True or false? Answer: false. Rationale: Administering topical medications requires clinical judgment and is outside the UAP's scope, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 177. The nurse should ensure a patient's advance directive is followed during care. True or false? Answer: true. Rationale: following advance directives respects patient autonomy and guides care, per ANA ethical standards. 178. A UAP can perform a patient's initial mobility assessment. True or false? Answer: false. Rationale: initial mobility assessments require clinical judgment and are within the RN scope, not the UAP's, per NCLEX-PN scope of practice guidelines. 179. The nurse should report a patient's medication error to the pharmacy. True or false? Answer: true. Rationale: reporting medication errors to the pharmacy ensures corrective action and prevents future errors, per the Joint Commission standards. 180. A nurse can ignore a patient's request for a family member to be present during a procedure. True or false? Answer: false. Rationale: respecting a patient's request for family presence promotes patient-centered care, unless contraindicated, per ANA ethical standards. 181. The nurse should include the occupational therapist in the care plan for a patient with a recent stroke. True or false? Answer: true. Rationale: occupational therapists address functional deficits post-stroke, ensuring comprehensive care, per the Joint Commission standards. 182. A nurse can administer a medication without verifying the time of administration. True or false? Answer: false. Rationale: verifying the time is part of the 5 rights of medication administration, preventing errors, per the Joint Commission safety standards. 183. The nurse should ensure a patient's discharge plan includes transportation arrangements. True or false? Answer: true. Rationale: including transportation in the discharge plan ensures safe transitions and continuity of care, per the Joint Commission standards. 184. A UAP can perform a patient's initial cardiac assessment. True or false? Answer: false. Rationale: initial cardiac assessments require clinical judgment and are within the RN scope, not the UAP's, per NCLEX-PN scope of practice guidelines. 185. The nurse should prioritize a patient with a new onset of confusion over a patient with a scheduled dressing change. True or false? Answer: true. Rationale: new onset confusion may indicate a serious condition, e.g., hypoxia, requiring immediate assessment over routine tasks, per ANA prioritization principles. 186. A nurse can delegate the administration of an oral PRN medication to a UAP. True or false? Answer: false. Rationale: administering PRN medications requires clinical judgment and is outside the UAP scope, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 187. The nurse should ensure a patient's room is free of tripping hazards. True or false? Answer: true. Rationale: removing tripping hazards prevents falls, promoting patient safety, per the Joint Commission safety standards. 188. A UAP can assist with performing a sterile foresight dressing change. True or false? Answer: false. Rationale: sterile foresight dressing changes require sterile technique and are outside the UAP scope, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 189. The nurse should advocate for a patient's right to access mental health services. True or false? Answer: true. Rationale: advocating for mental health services respects patient needs and promotes holistic care, per ANA ethical standards. 190. A nurse can delegate the evaluation of a patient's wound healing to an LPN. True or false? Answer: false. Rationale: evaluating wound healing requires clinical judgment and is within the RN scope, though LPNs can report observations, per NCLEX-PN scope of practice guidelines. 191. The nurse should include the social worker in the care plan for a patient with financial difficulties. True or false? Answer: true. Rationale: social workers address financial barriers, ensuring holistic care and discharge planning, per the Joint Commission standards. 192. A nurse can administer a medication without verifying the route. True or false? Answer: false. Rationale: Verifying the route is part of the 5 rights of medication administration, preventing errors per the Joint Commission safety standards. 193. The nurse should report a patient's change in mental status to the physician. True or false? Answer: true. Rationale: reporting changes in mental status ensures timely intervention, promoting patient safety, per ANA standards. 194. A UAP can perform a patient's initial skin assessment. True or false? Answer: false. Rationale: initial skin assessments require clinical judgment and are within the RN's scope, not the UAP's, per NCLEX-PN scope of practice guidelines. 195. The nurse should prioritize a patient with a blood pressure of 90/50 mmHg over a patient with a scheduled medication. True or false? Answer: true. Rationale: hypotension, 90/50 mmHg, may indicate shock, requiring immediate intervention over routine medication, per ANA prioritization principles. 196. A nurse can delegate the administration of a subcutaneous heparin injection to an LPN. True or false? Answer: true. Rationale: LPNs can administer subcutaneous heparin under RN supervision, per NCLEX-PN scope of practice guidelines. 197. The nurse should ensure a patient's discharge instructions are clear and understandable. True or false? Answer: true. Rationale: clear discharge instructions promote adherence and prevent readmissions, per the Joint Commission patient-centered care standards. 198. A UAP can perform a patient's initial vital sign assessment upon admission. True or false? Answer: false. Rationale: initial vital sign assessments require clinical judgment and are within the RN scope, not the UAP's, per NCLEX-PN scope of practice guidelines. 199. The nurse should report a patient's suspected abuse to the appropriate authorities. True or false? Answer: true. Rationale: nurses are mandated reporters and must report suspected abuse to protect patients, per state and federal laws. 200. A nurse can ignore a patient's request for a private room due to hospital policy. True or false? Answer: false. Rationale: nurses should advocate for patient preferences, like a private room, when feasible, to promote patient-centered care, per ANA ethical standards.